Hello and namaskar. Today we are going to talk about the remedy Lycopodium from Dr. Nash's Materia Medica, which is Leaders in Homeopathic Therapeutics by Dr. E.B. Nash. So we've been discussing the Trio of Flatulence and we've already covered the remedies China and Carboveg, and today we're going to talk about the remedy Lycopodium. Okay, so Dr. Nash starts by telling us about the trio of Hahnemann's antisoric remedies, which involves Lycopodium also. So, Lycopodium, sulfur, and calcarea carb together form this trio of Hahnemann's antisoric remedies, and they all act very deeply, is what he says. So the first he talks about constitution of Lycopodium, and then he goes on to talk about the GIT, about the urinary symptoms, about the respiratory symptoms, and the general sensorium of Lycopodium. So in the same way, we will proceed to first talk about the constitution of the remedy. So here he says that Lycopodium acts favorably in all ages, but particularly in the extremes of ages, which is from also acts on children, also on old people. So now I have made a diagram which should help us memorize at least the important symptoms of Lycopodium. So here you see that on one end of the arm I have drawn a baby, and on the other end of the arm I have drawn a grandfather. So you can see that it acts on the extremes of ages. We can remember it through this diagram itself. Okay, so this remedy acts on the extremes of ages, the constitution. Okay, and then we see that it also acts upon persons who are of keen intellect. So this brain over here denotes the keen intellect that this Lycopodium has, and even if he has keen intellect, he has keen intellect, but along with that he has this feeble muscular system. Okay, feeble muscular development. So this is a very famous symptom of Lycopodium actually. So they have keen intellect but feeble muscular development. Okay. And then we see that these they're lean people and they're leaning towards the lung and liver troubles. So lung and liver are very important spheres of actions for Lycopodium, especially liver, like we have also discussed in China. Dr. Nash actually, while teaching us Lycopodium, also tells us the difference of the pathology that happens in liver in Lycopodium and in China. So he literally boils down to the level of the pathology to differentiate between two homeopathic remedies and how they present in liver troubles. So it's very beautiful. We'll talk about that. So liver is a very important action, lungs are very important action, and both start from L, and Lycopodium is also itself starting from L. So in that way also we can remember its action on liver as well as on lungs. Okay. And it also has lytic acid diathesis, which also begins with L. Okay, so this is Lycopodium, which also forms the trio of Hahnemann's antisoric remedies along with sulfur and calcarea. It acts on the extremes of ages, also on children and on old people. It has major sphere of action on the lungs and the liver. It has he has keen intellect but feeble muscular development, and it also has lytic acid diathesis. Okay, these are lean kind of people. So that's it. Okay, then we talk about more about the constitution, and here we find Dr. Nash describing the face of the Lycopodium subject. So he says that it is sallow, sunken, with premature lines in the face, wrinkles in the face. Actually, he looks older than he is. So that is what he says. So in the same way that we have also denoted or drawn in the diagram. So see, there are wrinkles on his face, and he looks prematurely old. Okay, so he's sallow, sunken, with premature lines on the face, looks older than he is. Even the children are very weak with well developed heads but puny sickly bodies. So see, there's not that great muscular development. So they have puny, sickly bodies, although a well-developed head. And when sick, they are irritable, awake out of sleep, ugly, and kick and scream and push away the nerves of parents. So what happens when they are sick is also very important. So when any case comes to you, any child comes to you, especially, you can ask the parents that what is the difference. Okay, especially the difference in his behavior when he is healthy or and when he is sick. So you can see that when we talk about Lycopodium, then that patient when sick gets irritable. Okay, he gets irritable and he'll kick and scream and push the nurse or parents away. Okay, so that's there. Then we move on to talk about the GIT, and as I've told you already while we were discussing about Carboveg in China, that under Lycopodium, Dr. Nash tells us a very basic differentiation between all the three remedies that form the trio of flatulence. How will we choose which remedy to give to our patient when he has this distended abdomen and he feels that he's completely full with gas and he wants to get relief. Okay, so let's move on to that point, the differentiation of all the three remedies, and to understand which one to give for flatulence. Okay, so you see, in these three remedies, the differentiation depends on the part of abdomen which is distended, or the part of abdomen which has troubles. Okay. So when you see Carbovich, in Carbovich, the upper abdomen is mainly involved. The distension will be seen in the upper abdomen, and whatever troubles that the patient has, the complaints that the patient has, will be more more relating to the upper abdomen. The upper abdomen will be more involved. Whereas when we talk about lycopodium involves more of the lower abdomen. Okay, so again you see over here that lycopodium is involving the lower abdomen, and that is how you remember LL. Okay, and lycopodium involves lower abdomen. And when we talk about China involves the whole abdomen. So the whole abdomen is completely full, as if it's going to burst, full of gas, as if it's going to burst. At that point of time, you will think of China. Okay, so whenever your patient complains of distension of abdomen, you have to ask the patient which part of his abdomen feels more distended, which part of the abdomen is causing him complaints, troubles, and on the basis of that, you can differentiate between these three remedies and prescribe. Okay, that is how Dr. Nash makes it very simple for us to prescribe the flatulent remedies. Okay. Then he says that in Lycopodium, there seems to be almost a constant fermentation of gas going on in the abdomen, and this will lead to loud croaking and rumbling, and that will happen particularly in the region of the splenic flexure, which is on the left side of the colon, or the left hypochondria. Okay. Then he tells us that this flatulent is apt to occur in connection with chronic liver troubles. So liver is involved in this remedy, very important action on liver, like in China. Okay, so the flatulent condition is apt to occur in connection with chronic liver troubles. And in this liver, you see pathology in Lyco and China, he differentiates very beautifully. He says that the liver troubles of Lycopodium are more apt to be of the atrophic variety. Atrophy actually means what? So you see, trophic. Okay, so this trophic is meaning, actually means nourishment. Okay, so atrophy means there is no growth, there is degeneration, there is shrinkage. So that is what happens in Lycopodium. Okay, there is degeneration of the liver, while those of China are hypertrophic. So hyper means more growth. Okay, so there will be enlargement of the liver. So all that will happen in China, whereas atrophy will happen in Lycopodium. So it is very beautifully differentiated on the pathology level. Liver troubles of Lycopodium are more apt to be of the atrophic variety, while those of China are hypertrophic, both being equally useful in this sphere. So atrophy can be cirrhosis. Okay, for example, can be cirrhosis. Hypertrophy can be cancer of liver. Okay, in that way you can differentiate. Now he says that in Lyco you will find chronic liver trouble. Along with that you will find flatulence. Along with that you might find anal troubles also. So in anal troubles you see that there's frequent ineffectual desire for stool in these patients. And this frequent ineffectual desire for stool is actually due to the spasmodic, there's contraction of anus. Spasmodic contraction of anus, which prevents the stool and causes great pain. That is the cause of frequent ineffectual desire in what? In Lycopodium. But which is the other remedy that we've seen this symptom, very, very commonly in? So that is obviously Nux vomica, as you can see. So in Nux vomica also there is this symptom which leads to constipation. But the cause over here is irregular peristalsis. But as we've seen in Lyco, the cause is the contraction of the anus, spasmodic contraction of the anus. Okay. So that's about how it's involved in the liver related symptoms also. Next, feeling of satiety alternates with feeling of hunger. So they will feel as if they are full, and it will alternate with the feeling of hunger. Okay, so now see how he describes it. The patient sits down to the table very hungry. So he is very hungry when he is sitting down to the dinner table. He wants to have food, okay, for lunch or whatever, okay. But the first few mouthfuls fill him right up, and he feels distressingly full. So even if he is hungry, he is sitting on the table and he wants to have food, even just taking a few mouthfuls, and then after that he's going to feel like he's going to have this feeling of satiety. He will feel full. Dr. Nash says this alternation of hunger and satiety is not markedly found under any other remedy. It only predominates in Lycopodium. So you see now the importance of this symptom, because he is saying that it is not at all not found actually in any other remedy. It is the predominant feature of this remedy. So this feeling of satiety alternating with feeling of hunger is what you find in Lycopodium. Okay. Then he talks about the urinary system, in which he says that red sand in the urine is very important symptom of Lycopodium. Sandy, gritty sediment that settles at the bottom of the otherwise perfectly clear urine. And unless this condition is removed, we have sooner or later there's renal calculi, renal stone that forms in these patients, which will give them terrible attacks of renal colic. Okay, then he very beautifully tells us the symptoms in children and adult. He tells us that in children you see that the sand is sometimes found in the diaper after severe crying spells. Okay, so after crying spells, if there's sand in diaper, it means in other way, if we say that just before the discharge of the sand through the urine, the patient cries, the child cries. So there's severe crying spells just before the discharge of urine, the sand. That is a symptom. And in adults, you can find it out by this pain which happens in the back, in the region of the kidneys, which is ameliorated after the discharge of urine containing the sand. Okay, there's pain already present, and after the discharge of urine, it will go off. Okay, that's there. And Dr. Nash actually says that no one remedy helps these cases more promptly or permanently than Lycopodium. So these kind of patients of urinary symptoms. Okay, that's it. That's what he says. He also gives us one symptom of impotency in the male reproductive system that is there in Lycopodium. It is also a great remedy for impotency. Then let's go and move on to the respiratory organs. Over here he tells us again that the first of all that the lungs are involved. It's very important sphere of action, as we have already discussed. So it's a very important sphere of action of Lycopodium, that the lungs are involved. And Lycopodium affects the right side most, or at least the troubles begin on the right side, and actually they go on to the left side. Then this is a very famous symptom of Lycopodium, and this is how I've so you can just imagine that this patient is throwing a ball from one of his arms and catching it through the other, and this ball actually have written right to left on it. So which means that this the symptoms of Lycopodium actually move on from right to left. Okay, they begin in the right side and they move on to the left side. This is what Dr. Nash also says. Okay, then tonsils are swollen and there is separation in them. There's pus formation also. Now here Dr. Nash also tells us about the remedies that he successfully has used for tonsillitis, which are lachesis, Lyco, Lacaninum, Phytoloca. All are famous remedies for tonsillitis that he has also used it very well. And he also tells us about diphtheria. In diphtheria, if the disease begins in the nose or right, again right tonsil, and extends to the left, see, so it starts in the right and extends to the left, then you can again think of Lyco. You will think of Lyco. Or again, this also happens in merc protoiodide. Okay, so it begins in the right, it moves to the left. This can also happen in merc protoiodide, or it can happen in Lyco. Now how to differentiate? So when Dr. Nash talks about merc protoiodide as a remedy, okay, in his Materia Medica, he tells us that this remedy has thick yellow coating at the base of the tongue. So there's thick yellow coating at the base of the tongue. Along with that, there's fetid breath, and there's this flabby tongue showing imprint of the teeth. Okay, so if you have this thick yellow coating at the base of the tongue, and if these other symptoms are also there, then you can think of giving merc protoiodide. Okay, and if you have concomitant symptoms for Lyco, you can think of Lyco. So until now, under respiratory organs, we've seen first of all that its action on tonsils, right? It has a great action on tonsils. We've seen its action in diphtheria, right? And we've differentiated with Lyco, with merc protoiodide, and we've seen that its troubles begin from the right and go to the left. And this is not only about the respiratory symptoms, but in general, or any symptom that Lycopodium has might and can go from right side to left side. So until now, you all know that Dr. Nash loves to differentiate between remedies, and in that way only he teaches us Materia Medica. So he discusses the diphtheria of both the remedies, Lycopodium and Bromium. So in Bromium, you see that the trouble begins below and comes upwards, meaning the trouble will start with maybe the bronchi, maybe the larynx, and will just move up Okay, then after laryngitis, the patient will have coryza. The nose will start running. Okay, in bromine, so it begins below and it comes upwards. Whereas when we talk about lycodiphtheria, it begins above and comes below. So the fauces will be involved and then it will come down. So since now we're talking about diphtheria, so whatever I said that like the lines will be involved and then the nose will be running. So this can also happen, okay, in bromine, because bromine may it begins below and goes upwards. But now since we are particularly talking about diphtheria, then we should then what will happen is actually, first of all, as I said, the lower part of the respiratory tract will be involved and then it will involve the fauces after that. So that will happen in diphtheria. Okay, after that the fauces will be involved, the diphtheria will be there. Okay, the membrane formation and all will take place. Okay, so that will be there in bromine and in lyco. So this, it is reverse. Okay, in bromine we see it is beginning from below and going upwards, whereas in lyco we see it begins above and comes below. All right, now you see this chronic dry catarrh of nose which becomes completely closed, so the nose is blocked so that the patient has to breathe through the open mouth, especially at night. So chronic, okay, chronic dry catarrh. And there are also other remedies that he also mentions which can be used for this. There can be ammonium car, there can be heparsulf also. In infant, sambucus is a very good remedy for the babies who will who have this blocked nose and will be breathing through the open mouth. Now this remedy is also a very important remedy for pneumonia. Okay, so neglected, maltreated or imperfectly cured cases will be saved by lyco from running into consumption, is what Dr. Nash says. What is consumption? So it is TB. So any these cases might have got turned into a case of TB, might have been attacked by Mycobacterium tuberculi, but that might be saved by lyco if you give it at the right time. So neglected, maltreated or imperfectly cured cases saved by lyco from running into consumption. Now it may be indicated even in the later stages of acute attack itself. Okay, so you have an acute attack, you have pneumonia, but in the pneumonia itself, the later stages is somewhere when you can use lyco. It affects the right lung again the right lung, especially if liver complications arise. It is very so liver and lung are very much related. If both are there together, both are involved together, you have certain lycopodium symptoms, and lycopodium must help. So in pathology, you see, he says that the disease has passed the first or the congestive stage. Okay, the congestive stage has been passed, and generally the stage of hepatization is there now, or lycopodium is in the last, or the disease, sorry, is in the last part of this stage, of this hepatization stage, and is trying hard to take a favorable turn into the breaking up, or the third stage, which is the stage of resolution. So these are what? So these are the stages of pneumonia. So now let's take this opportunity to revise a little bit of our pathology. Okay, we have learned this in pathology subject. There are stages of pneumonia. Let's see, the first is the congestion stage, which lasts for 1 to 2 days, in which the lung is congested with RBCs. And then there is red hepatization, which is for 2 to 4 days, and in this stage it is called as red actually, since the lung is red in color due to RBCs again, so that is why it is called as red. And hepatization, this is a word which is mostly used in relation to liver. So right now over here it is being used because the lung gets liver like consistency, which is due to fibrin. So the lung becomes very firm, like the liver is firm due to fibrin. And then there is gray hepatization stage in which lasts for 5 to 8 days, in which you will see that there is the RBCs will get disintegrated, and that is why there will be this gray color that the lungs take. And then there will be resolution, which will be for 8 to 10 days. Okay, but for resolution, for the relief that finally comes on, the patient goes through these stages. So now Dr. Nash very beautifully tells us that lycopodium will be involving this hepatization state. So just after the congestion stage is over, will come on the lycopodium symptoms, and they will be there in the hepatization state or stage. Okay, hepatization state or stage, or in the last of part of the stage, meaning in the gray hepatization, or also it can be there in the red hepatization also it can be there. And it the patient or the disease is trying to come into the stage of resolution, but it might not be able to come over there. Okay, so that's there. So let's see what he talks about in over this further. So here he says that just here is where many cases die. So just before going to resolution only, if just in the stage of gray hepatization or red hepatization, the patients might die. The cases die. Neither free expectoration. So what is pneumonia? Pneumonia is when your lung cavity is full of fluids. Okay, so it is full with fluids, and that is so this that fluid, that mucus, that expectoration is not coming out. There is no free expectoration nor perfect absorption of the disease product taking place. So what he means to say is the fluid which your lungs are completely full with in pneumonia has to be either absorbed or must come out through your mouth so that the lungs are cleared out, right? But both of them are not happening, and that is why the symptoms are that there is extreme dyspnea in this patient, and the cough sounds. What is dyspnea? Dyspnea is breathlessness. Okay, so breathlessness, extreme breathlessness, extreme dyspnea, cough sounds as if the entire parenchyma of the lung were softened. Okay, cough sounds will be such that the whole lung is softened. Even raising whole mouthfuls of mucus does not afford relief. So now the lung is so full of mucus, so full of fluid, that even if the patient is, raising mouthfuls of mucus, then also there's no relief. There's so much of congestion in the lungs. The breath is short, as we see that there's breathlessness. The breath is short, and the wings of the nose expand to their utmost with a fan like motion, and this is also very characteristic of Lycopodium. And now is the time when Lycopodium does wonders. That is what he says. Now is the time when Lycopodium does wonders. If you find this kind of state, then you can give Lycopodium. Again, even when this stage is imperfectly passed. So what happens if you do not give Lycopodium even at this stage? It will be imperfectly passed, and the patient still coughs and expectorates much thick yellow purulent or grayish yellow purulent, sometimes fetid matter. Purulent meaning pus like, or this pus. Okay, there's thick yellow kind of expectoration that comes out, or grayish yellow expectoration that comes out. It is purulent, and it is sometimes fetid also, bad smelling matter. And it also tastes salty, okay, tasting salty with much rattling in the chest. Then Lycopodium is indispensable, is what Dr. Nash says. Now here the choice may have to be made between this remedy and sulfur, kali hydride or silicea. So these are the differential remedies that you need to think of in this stage. Right, so that is what he talks about, the respiratory symptoms of Lycopodium. Now he will talk about the general aggravations, the general sensorium of the remedy. So talking about the aggravation, so he says that there is 4 to 8 pm aggravation of Lycopodium, which is general in Lycopodium. So all the symptoms of Lycopodium have this ability, and they might get aggravated during this 4 to 8 p.m. wala time period. Okay, so that time period is when Lycopodium gets aggravated, and Lycopodium gets generally activated. But there are few remedies like Colosin and Helleborus which have particular symptoms which get aggravated during this time period. So in Colosin you see that the abdominal pains are aggravated during this time period. In Helleborus we'll see that headache with coryza gets aggravated during this period. Okay, but in Lycopodium you see all the symptoms will get aggravated. It may be the respiratory symptoms, or it may be the urinary symptoms. Whatever is involved will get aggravated from 4 to 8 p.m., which is very, very, very characteristic in Lycopodium. Now Lycopodium profoundly affects the sensorium also. Okay, what does it do while affecting? It depresses. Okay, the patient lies stupid, eyes do not react to light, lower jaw drops, apparent impending paralysis of the brain takes place. And this condition, okay, this depressed sensorium condition may be found even in the advanced stages of different acute diseases. Okay, like typhoid fever, like meningitis, like pneumonia. Okay, it might be involved in the advanced stage of these different conditions. Like we saw in pneumonia, in the hepatization stage it is involved. Okay, then it is not only in acute disease but also involved in chronic form. Now, how is it involved in chronic form? See, we've talked about old people, right? Lycopodium patients also gets prematurely old, and Lycopodium as a remedy also has a good action on old people. So failure in the sensorium is seen. What happens is the memory fails. They use wrong words to express themselves. They mix things up, generally in writing, spelling, and are in short unable to do ordinary mental work on account of failing brain power. And then you can think of Lyco also. So whenever you see all these things taking place, the memory fails. They use wrong words to express themselves. Yeah, and they're not able to talk exactly what they want to. They will just mix things up, and they're making very many mistakes in writing, in spellings, and all that. Okay, then you can think of like, what are the other remedies? Anacardium, also a very important remedy for memory loss. Phosphorus, baryta, opium, picric acid, agnus castus. These are also some of the remedies that you can think of for memory related issues. Okay, so this is what we have about Lycopodium, and now let's just very quickly revise. So in the very beginning, we saw that this remedy forms the trio of antisoric remedies of Hahnemann, along with sulfur and Galkiriaka. And in constitution, we saw that children or old people can also be involved. There's keen intellect, but there's feeble muscular development. They have lytic acid diathesis L, lungs and liver involved LL. Okay, and then we talked about the GIT, in which we saw a very very important thing, that Carbovate, China, Lycopodium are the three trio of flatulent remedies, right? And we saw that in those three remedies, which remedy is involved for what and how to choose between these three for flatulence. So you see, for Lycopodium, you will see that L stands for Lycopodium and L stands for lower. So when the lower abdomen is involved, you have to think of the remedy Lycopodium. Okay, when upper abdomen is involved, you have to think of the remedy Carbovage, and when the whole abdomen is involved, you have to think of the remedy China. Okay, again, so for lower abdomen L, the remedy indicated is Lycopodium. For upper abdomen, it is Carbovage. For the whole abdomen, it is China. Okay, that is what we talked about. And we've also seen that, okay, I just forgot to revise the constitution part, in which we also talked about the wrinkled face, the prematurely old face, and the children which are also weak and have this puny sickly bodies. And we see that when these people are sick, they are irritable and they awake out of sleep very ugly, right? They are irritable in sickness. Then when we were talking about GIT, we also saw that this remedy has a great action on liver, right? This remedy has a great action on liver, and it has this pathology that involves atrophic kind of troubles, and China has hypertrophic kinds of troubles. And then we saw that this remedy also can have anal troubles, in which there is contraction of anus causing frequent ineffectual desire for stool, like we have seen in Nux vomica also. We know it is there in Nux vomica also. And there's this very important symptom in Lycopodium, where the feeling of satiety alternates with the feeling of hunger, right? They will feel full now, and then they will feel hunger. Okay, just now they're hungry, then they will eat a few mouthfuls, they will feel full, and then again they will have this feeling of satiety very soon. Okay, then it also has this action on the urinary system, is what we have talked about. There's this sandy gritty sediment that comes out through the urine, and children will cry, and after the crying spells you will find sand in the diaper, and in adults you can see that this pain which is ameliorated by discharge of urine. Then we went on to talk about the very important respiratory symptoms of this remedy, in which we've seen that usually the right lung is more involved. Okay, the right side is more involved. First the right side is involved, and then it goes on to affect the left side. What is involved is the tonsils can be involved, and even diphtheria can take place. In diphtheria we also differentiated with the mirth protoiodide, and we also talked about how bromine and lycodiphtheria are different. In bromine it begins from below and it goes upwards, whereas in lyco it begins from above and goes downwards. Okay, then we talked about the nasal blockage that happens in Lyco, and other remedies like Sambucus, ammonium carb, heparin sulfur are also involved. Then we talked about pneumonia, and we also talked about the stages of pneumonia. We saw that this remedy is mainly involved in the hepatization stage, and we've seen that there's this extreme dyspnea, and very important fan-like motion of the alae nasi is seen. Thick yellow purulent expectoration is there, salty expectoration and fetid expectoration, or it may be also be grayish in color, grayish yellow in color. Okay, then also you can give Lycopodium, and we've in that way we have almost covered this remedy. We've also seen this 4 to 8 p.m. aggravation of Lycopodium here only just now. We've seen this 4 to 8 p.m. aggravation, and then colosynth and Heliborus niger have been differentiated, and it also affects sensorium to cause this patient like stupid, eyes do not react, and lower jaw drops, and all that happens. And we've seen that it can be involved in typhoid fever, meningitis, and pneumonia, like that is the advanced stages of the acute disease, or it can also be chronic form, where the memory failure or the confusion of mind actually usually takes place. So this is all about Lycopodium that we have done, and I hope you can remember this remedy now. At least you can remember a few important points about this remedy now. Okay, so now bye bye. Let's meet again when we'll talk about another beautiful remedy.